So here we have the laser given to me by Dentlight. It comes with a guide on the power, how to use it, what power, what mode, technique, and then a little flow chart, how to turn it on, how to turn it off. Super simple once you get it. And then they give you this. You have to have this posted outside of every room you're using the laser in. 2 sets of glasses, one for the patient and one for an assistant, a shield that attaches right here, and then a bunch of sleeves to keep you from having to wipe that down all the time, and then the tips. So I've never been a huge fan of lasers because they're very bulky. It's just a lot. They're very expensive. There's a lot to set up. You got a foot pedal. You've got all these extra cords and wires and all these things. Just to stop a little bit of bleeding sometimes is not really worth it for me. So what I really like about this is the whole thing. This is it. There's no foot pedal. There's no other screen, with like the Gemini or whatever. They got the whole big deal. It's all compact in here. And this is the charging thing. It comes with a little charger, plugs in right there. And then this is it. You click 4 times to turn it on. And then that's the power. And then you just click that to change the power. 1 is pretty good for stopping bleeding. 1.5 I've found is good enough for doing gingivectomies, frenectomies, stuff like that. And then like 2, you can get a little higher for crown lengthening and such. And like I said, it's got the guide over here, so you really don't even need to go over this. And that's why I believe it goes all the way up to 3, yeah, and then it just restarts. It does pulse and continuous wave. And then when you're ready to go, you hold this for 4 seconds, then it'll show a green light, and then you hold this to, again, to use the laser. And then when you're done, you just set it back there. And if you leave it off, if you don't touch it for long enough, it'll just go back into a standby mode, and then it'll eventually shut itself off after a few minutes. But this thing's great. I made a little video where I used it for just removing a little bit of tissue around a bridge seat that I was doing, and a little blood, a little bit of hemostasis. But it's great. The tips are super. You put them right in. You don't have to lengthen them and cut them and do all this that you have to do with some other ones. Yeah, big fan of this, and it's like a third or a fourth of the price of your typical everyday laser. And this isn't one that can cut teeth or can cut any hard structure. This is all soft tissue. But I mean, if you're just needing, you don't want to slather a bunch of hemostat on there, or you're dealing with a lot of bleeding, or you're doing a lot of like gingivectomies and crown lengthenings and stuff like that, this thing works great. Real fast and simple. Takes 2 seconds to set it up. The whole kit comes with everything you need. You don't need to buy anything extra. It's got the how-to guide. I mean, I pretty much explained the whole thing in about a minute, how to use it. But yeah, I'll have a little video after this, kind of showing just a real quick me using it in the mouth. But yeah, so these are the people at Dentlight. This is their ultra fast and handheld. I mean, I got a big hand, but that's about it. Pretty much like a big hand piece. And that's all it is. Real simple. These are the same people that make my light. See right there, it's been in standby for long enough, so it shut off. Or it hasn't been used long enough, so now it's in standby, and then after a few more minutes, it'll shut off. But yeah, these are the same folks that make the light that I use to make my videos, or my camera, that I use to make my videos. They're in Plano, Texas. Great family business. And yeah, they wanted me to kind of show you guys this deal and let me test it out for a little bit. So far, I have to say that I love it. So yeah, I'm going to show this video now. Thank you.
Okay, so here's the laser in use. Right now it's at a 1. That little green light kind of shows where the laser is pointing. It does not mean it's engaged. When the laser is engaged, you will not see this. The camera is picking up what's happening right now, but you will not see this with a naked eye or with glasses on. Everyone in the room, including myself, is wearing glasses at this point, but the camera's picking up what's going on. But anyways, I started at a level 1 to do a little, just to stop the bleeding. Then I moved it up to a 1.5 to show you guys a little bit of gingivectomy here, because that gum tissue was kind of growing a little bit up over those margins, and I wanted to knock it back down a little bit. That's just irritation from the temp. This patient had this tooth pulled about 6 weeks prior to this, and our temporaries always have the Pontic press up into the socket to make sure we get that nice, good healing kind of curved concave form there, so we can get a really pretty looking Pontic. But what that does do is sometimes that can make the gum tissue a little bit angry, but you can see the really beautiful cautery and removal of tissue with that. And then it's really simple. You just press that green button to cycle through the power. It only goes up to 3. And I went back down to a 1 here to stop a little bit of bleeding right in this Pontic area, which you will see later in the video was not enough, but it didn't have any effect there. And then a little bit on the mesial there. And it's really important, right here, we've got that papilla. I don't want to cut that papilla away. That's very important tissue to maintain. That's right in between, that's a central papilla there. But just that level 1 doesn't remove any of the papilla, but stops that bleeding instantly. You will see some of the charred tissue and clotted blood, and that wipes away really easily with our 3-step, our chlorhexidine tubulocin bleach, holy triad, coined by Struppenbrum. And so we do that, and that removes everything, gives us nice, beautiful, clean preps. And as you can see, the bleeding has not come back. It's not bleeding right now. It's not bleeding into the sockets. When I do put this bridge on, you will see a little bit of bleeding in the Pontic area when I press it in, but that did not make its way into the actual preps or onto the actual abutment teeth there. It was just in the center. Now, if later down the road there was some darkening under the margins or some blackening there, then I have no problem. I'll cut this thing off and make her a new one, and not charge the patient. If there's any issues like that within the first year with anything, then I call that my error, and I'll replace that for the patient. I scrub every every prosthetic with bleach before I cement it. So I'll try it in without cementing, obviously, as you should, to check the margins and bite and other things. But the moment you do that, you're introducing bacteria and other things into that. So I always just give it a good scrub of bleach and rinse that out thoroughly, because bleach can leave a residue. Right here, as I press this on, you will see right there's that blood up in the Pontic area. But like I said, I don't think that made its way into, excuse me, into the margin area there. Now I do a quick tack around that and around the back. I do a good enough tack to make it still so I can remove it, but hard enough so that I know the margins are sealed at this point. So the margins, I tack enough and that light is bright enough to seal those margins off, because when I do what I'm doing right now, which is scraping with an Explorer, even just a little bit, just breaking that off, I know I'm going to introduce blood into the area. And I absolutely do not want blood around the margins if that cement is not at least cured around those margins. So I tack a little bit longer than I normally, or than just to harden it up a bit, just because I want to make sure that it cures up into that. And I know it has, because when I pluck away, it breaks off very easily and it doesn't peel off, and it's not soft or still liquid around those margins. If I get a nice clean break, then I know that it's cured around the margins. So I remove the bulk, and then we'll go through, we'll floss. I don't floss under the Pontics. frankly, because I just don't, and I clean those out with an Explorer tip later. And obviously, we check all of this with a X-ray later to make sure there's nothing left in there, and then we do a full cure. After this full cure, and you'll see, and some hygienists, if you're watching this, will cringe. I will take this is an Explorer just to check the margins, make sure everything's good and sealed where it's supposed to be. But I will take a scaler and I will dig into those gums as much as I need to get every single flake of cement out of there. It's better to beat up the gums to get everything out than to leave something in there for later, especially in the front, especially with these Pontics. This is that scaler right there. I like using a curved pointed tip. I have no idea what they're called. I forgot all that stuff after dental school because it's totally pointless to remember. But yeah, I get in there, I beat that tissue up, and what I'm doing is I'm curving that around the Pontic to make sure also that later a patient can get some threaded floss through there, so they can take a floss threader and poke that up under the Pontic and thread floss under there to remove any tissue. Yes, these Pontics are very intimate up in the front here with the tissue. Um, some dentists like that, some don't, but this is what the patient wanted. She did not want it to make it look like there was any gap or anything there. And so we always let those patients know you absolutely have to floss under this, keep it clean, and to avoid that tissue from getting angry and you packing food under there. So anyways, here it is at the end there, just taking a good look at it. I'm going to check the bite after this and all that. But hey, thank you guys for watching this. Check out Dentlight. They're where I use my camera. They're who makes this laser, and they're based out of Texas here. So Google them, give them a look if you're interested in any of that stuff. And thank you all for watching. Have a great one.